So today we've brought a lady by the name Dr. Beverly Cheserem. Have I said it correctly?
Yes.
Dr. Beverly Cheserem, a neurosurgeon. Welcome to the show, darling.
Asante Sana, it's not every day I spend time with the Duchess.
Oh, thank you, darling. Thank you. You are welcome. This is my throne.
Yeah.
It's a small one. It's not like Buckingham Palace, but it's my small throne that I just spew out information. How long have you been doing medicine?
That's a really long journey that'll give away my age.
Oh, okay,
but to put it into context, medical school 5 years, and then you have your internship. If I skip forward, residency in neurosurgery, 8 years, 3 years of extra training, and then I've been in practice. Yeah.
That's nice. Now, let me just get into the conversation because I'm a layman when it comes to this. Many Kenyans fall, get blood clots, get injuries of the brain from accidents, some even children when they fall. For us who are mothers, tunakwambia sugua with a robe or something. But sometimes I heard that this causes a lot of brain injury. So I'll ask you from a medical person, from a medical point of view, what causes brain injury and also what is brain injury?
So brain injury is a very broad term about disruption of, the brain is not working well.
Okay.
And if I just take it into a broad term, you start to develop your brain right from the time when a woman is pregnant. In the first 12 weeks, there's a lot of rapid brain development.
Okay.
So you can get brain injury at that point, depending... So shortly after conception, one of the first things that you spend a lot of energy developing is your brain.
Yes.
That's called the first trimester.
Yes.
So the things that can injure a growing baby's brain are factors to do with the quality of life the mother is living. So if you're doing drugs, taking alcohol, or if you're deficient in your nutrition, in particular, if you're not taking folate. So enough vegetables and folate.
Folate is the folic acid?
Folic acid, yes. So if that is very essential for brain development. So if you're not taking that, then the brain may not develop very well. And that's like the head start in life. And then you need other favorable conditions. So the better the mother is during her time of pregnancy. And here's a fun fact for those who like fun facts. The way a woman is able to nourish her baby was determined when she was a baby in her mother's womb. So if you want to change how a generation grows in the womb, you need at least 2 generations of healthy living for the women.
Mine, my child's, and her child's.
Yes. So at the moment, the child you're carrying, you're determining how that child will carry the other child. So...
Okay,
their child.
Okay, that's a fun fact.
Yes.
There's something I just want to get back a bit.
Yeah.
You talked about the ladies or the woman's lifestyle.
Yes.
We are in a generation where many women, and I'm going to call it out, they really take quite a lot from the holy herb. You know what the holy herb is, to a lot of alcohol. And I hear people saying it doesn't have an effect. And in fact, there's this particular brand that, quote unquote, apparently pregnant women should take, lactating mothers. What are your thoughts about that?
So there is no definite study that gives a minimum allowable amount of alcohol that you can take or drugs. So, and actually, most people do not realize when they're first pregnant, it takes you a bit of time. So therefore, there's an investment in women in the life that they lead. In other words, live a clean life and you give your child the best start in life, and not think that it's acceptable to be drinking while pregnant or trying to smoke various vegetables, etc.
And also chewing certain vegetables.
And chewing, whether you are chewing, injecting, I don't know, putting it in words. You know, your body really is an important part of how your child develops. And it's important that that message gets across to all the women who are listening.
So now we've come out from where the mother could cause brain injury to the child. What else, or how else can someone get brain injury?
So after that, there's that stage when we're trying to deliver the child. And it's important that women go for their prenatal care so that if you have any complications in delivering, because the child depends on you for their blood supply. But at the point where they're delivered, they have to change from the system of depending on you for everything to breathing for themselves.
Yes.
So it's important that women, get help at that point. Then when you get to early childhood, once again, nutrition, but then the other factor starts coming to play, the rumble and tumble of life. So if a child falls from a height, and that height is relative to their weight. So say, for example, for me and you, if we fall from standing,
my God.
But if you are holding a child, that might be quite a distance, especially if they fall on hard ground. So that's about all the physical activity. Then as you're growing, of course, the sports that you're doing, and then there's the road accidents, there's occupational hazards as you're growing older, and so it's in different stages of life. There are things that you can consider threats that can cause injury to your brain. And here we've talked about direct trauma.
Yes.
But other things that can cause problems are infection. So people talk about meningitis.
Yes.
That can inflame the brain, and then things like strokes or bleeds. So let me just put it a different way. Your head is like an egg. It's special. You treat it specially, you treat it well, and you try and limit the factors that can cause any trauma, any infection, any nutritional deficiencies, so that you can have the best quality of life, not just now. The way you invest in your brain also determines how you will be as you grow older. Okay. So if you want to have a fantastic, like I look at the Queen, for example, in the UK, as you're a Duchess, don't need to make your example.
Exactly. She's really lived her life.
A lady in her 90s, literally leading a nation.
Walks with her handbag.
Walks with her handbag, has an opinion in life. If we want to have that quality of life, we have to invest.
There's something that you said I want to plug in. You've talked about if a baby drops. Rumor has it, I don't know if it's a myth, that if a child was to drop, their skulls will develop better. And then people drop their children or accidents happen and they tell you, Etapona, Nim Dogo.
Hey, Duchess, you're giving me a heart attack here.
No, I've had. That's what I'm saying. People do say, and that's why we're having this conversation, that with children, their skulls, like they regenerate afresh when they're younger than when you're an older person. Is that true?
So your ability to regenerate your brain is much, much higher the younger you are. Even that includes children. That said, that's not a reason to start bouncing your baby's head. Also involved in that is other cultural practices, like trying to shape the baby's head or banding, tying it.
Yes.
The skull is soft. It'll grow. It'll accommodate. A lot of the injuries that children get, they accommodate quite well. But why take the risk?
Would that cause brain injury? Because we have a lot of Africans who try and shape the head of the child after birth.
Just touching it doesn't tend to cause a problem, but there are certain cultures where they literally tie a tight thing around the head. Now that affects how the brain grows, because the brain is supposed to grow like a flower. Imagine you put a flower and then you're putting all these limitations on it. It does pay a price in how that brain develops in the long run.
You talked about trauma, that it can cause brain damage.
Yes.
What kind of brain damage can trauma cause?
There are several things. So the first one is, imagine like a shock wave, like waves going through your head. This is something you call like diffuse axonal injury. So the shock is transmitted and your brain is full of loads and loads of connections. Imagine like a superhighway of networks.
Yes.
So in that case, you might do a scan and a CT
like
scan.
A server.
Like a server.
Yes.
You might do a CT scan and say, it looks fine. But if you're to do more detailed scans, you'll see that the little connections are lost. And I look at your brain like a library. Through your life, Duchess, you have, your friends, your birthdays, your memories. You filed them very well.
Family.
Your hopes, your dreams, even the people you don't like.
Yes.
There's a section for them.
Yes.
So when you have an injury, what you cause is a disruption of the library. Things get really, really disorganized. Now Duchess comes, not talking the same, not able to do her show the same way.
All of a sudden I'm talking to my enemies.
Imagine. Yani unajaribia sifa. But so it's things like that.
Yes.
So that's when the energy travels. The other one is when maybe the shape of the head, it molds itself in. So you have a fracture that goes in and that takes space that's normally occupied by the head. It can cause damage to the brain and make you more likely to have seizures. And also, then there are bleeds. The bleeds can be outside the brain, inside the brain, or even within the center of the brain. And everywhere, depending on where that problem happens, gives you a different type of problem.
Can a bleed cause a clot?
So a clot is a bleed. But a clot is ukieka tuseme damu kwa sufuria.
Yes.
When it now congeals, that's a clot.
Yes.
So anytime you have any bleeding anywhere in your part of the body, that's a clot. And you can get that from trauma. You can get that from stroke.
Like that.
You can get that from certain brain conditions where you have friable blood vessels and suddenly you have a bleed. So you can get it spontaneous or it can be aggravated by trauma that you've had inflicted.
Spice.
Today we have a doctor, Dr. Beryl Cheserem, a neurosurgeon. Pardon me, why was I about to call you a neurologist? Forgive me for that. And we're talking matters of the brain and brain injuries. If you're just joining in and you have a question, I've seen a few on our timeline. We shall be answering them as we go on. Please feel free to do so and send them in. Today we have a doctor. Duchess is not a doctor, I am not allowed to do certain things. I don't have the expertise. But today we have someone who has the expertise. Now let's get back to the questions we had. What happens when one gets a brain injury?
So the brain injury it depends where it's affected.
Okay.
So me and here I can have a model of your brain.
That's why I was telling you, plug in www.spicefm.co.ke. Just raise your model so that at least my cameras can.
I have to double check just to make sure you can see.
Yes, we're good. Yes.
Sawa. So this is like your brain and the way it's shaped. The good thing is that it's in two halves which mirror each other normally.
Like a bean.
Like a bean, yes. Exactly. Except that the right side of your brain takes care of the left side of your body, and the left side of your body is taken care of by the opposite side. So if it's the front, this is now about your personality. Okay. You know what makes you Duchess?
Yes.
So there's a lot of executive decisions that come from
that. Of course.
There is a lot of understanding what things are, how they're named. There's even associations. Things like you smell something and you remember that's a nice perfume. That scent reminds you of food when you were in boarding. Yeah.
Yes. Or you have burnt meat.
Or you burnt meat. So it connects you. It also helps with your continence.
Okay.
So sometimes when you have problems at the front,
frontal part of the brain.
Your frontal part of the brain.
Okay.
It also helps with something called impulsiveness. Yeah?
Okay.
So you know what, the way when you're like 2 or 3, when a 2 or 3-year-old gets hungry or wants something, they do it immediately.
Yes.
Over time, you learn the social norm. So the frontal lobe is very important in fitting in society.
In terms of discipline and structure?
Discipline, structure, but also understanding subtle cues.
Okay.
Like sarcasm, or knowing that look your mother gives you when you go somewhere.
Yes.
That means I'm not suggesting you do this.
Yes.
So there's a lot of social norms that comes from your frontal lobe. At the back of the frontal lobe is your movement.
Yes.
And even before that, there's the initiation of that movement. And then behind that is a sensation. You go even further back, there's your vision here right at the back.
Okay.
And then on the side, you have some things about your mood, storing some of your memories, even on the inside, and also your hearing.
You said the back part is for the vision.
The back is your vision.
So that is what, if it was affected, someone might lose their sight.
So the thing about vision is very interesting. So you have the eye itself.
Yes.
An injury there or a problem there will cause visual loss.
Okay.
Then I've got a different model that shows your skull.
Okay.
And there are many different holes. One of them is a hole for your optic nerve.
Yes.
Which helps you to see and
from
how
your
you
skull.
Move. Mm-hmm. Exactly. And then the nerves go all the way across right to the back. Okay. So injuries at different points of your whatever can cause you different forms of visual injury.
Yes.
So ukiona kama hauoni vizuri, this is what I recommend. First, if it's happened very suddenly, just go to casualty. Okay. So they can figure out, are you having a stroke? Because some strokes affect just areas of the eye. And then there are other forms of brain inflammation. Or they can also look inside your eye to make sure you haven't had like a bleed inside that eye or a problem, And if it's happening slowly, then also consult either an eye doctor, neurology or neurosurgeon. Go to your local casualty. Basically, seek help.
Seek help. Okay.
Then at the base of the brain is about balance.
Yes.
And the balance is many things. You are walking, you're stitching, you're holding something, coordination. Your good dance move on the dance floor has something to do with that. And then it all connects to the spine. When you injure your brain, it's in grades. So there's mild. Mild is, there's no loss of consciousness. You don't just feel yourself, maybe a bit of headache, and you're okay. If you lose consciousness, that goes more towards moderate.
Okay.
Yeah? And the moderate tends to have disruption in what you do, and you can have even loss of your immediate memory. I know guys who have fallen.
Moderate and you're losing memory, doc.
You will lose what happened just then.
Okay.
Some people have retrograde or antigrade. Retrograde means things that happened just before that you don't remember. Antigrade means from that point going forward.
This could be caused by what?
So remember they told you your brain is like a server.
Yes.
And when you have brain injury, it's like a shock, like you've had a power surge.
Yes.
So the way information is stored, it just doesn't store that information properly. So later on, when you're going back to the library to say, what happened Jana afternoon? You're like, I'm not so sure.
Is that why some people have things we call selective amnesia? I know we make jokes about it, but genuinely there are people who can't remember things they did like yesterday. You really have to jog their memory. Is that brain injury or is just that a problem with the way their brain functions?
There are some people who've had injury for various causes, and they get something called like Groundhog Syndrome. I don't know if anyone who's watched Groundhog Day.
Yes.
Where you don't form new memory. Every day is like the same day.
Yes.
Yeah. That's a very serious one. There's a movie, and that movie is based actually on a real condition.
Okay.
Where guys are just just not capable. It's like you're in the library. Oh, let me put it this way. It's like you're writing on the blackboard. Every day you rub, the following day you start writing again.
You get the same
So the
memories.
ability to build on that information is not there.
Okay.
Yeah? If you have an injury, that can either be temporary or permanent. So that's why you need some time. The brain takes up to 18 months to recover after an insult. So even if you meet somebody in hospital or shortly after hospital and they're not catching, tunasema kunyita, ama is my sheng out of date.
Me and you on the same. We are not on those lambatong things.
Yes, the brain is shebeteng. I don't understand those ones.
Yeah, that one I get it.
That means the brain is still is still healing. You need to give that person time. They might not remember what happened in hospital or shortly afterwards, but if you meet them 6 months, a year later, they may be in a position now to form new memories.
So the brain will recover in 18 months. And if it hasn't, does it mean that that person is damaged? Because I've had, and I'm sorry to use this word, I've had people say, he's a cabbage, she's a cabbage.
So actually, we said mild, moderate, and then severe.
Yes.
So the more severe the injury, the rate of recovery may not be complete.
Okay.
And so the time when we say cabbage is when basically you have the ability to do certain functions. Your heart is beating, you're breathing, but your ability to be the person that you are, to know yourself separate from someone else, is affected. And that can happen in severe
that's
injury.
when they can't recognize you.
So yes, it's like their frontal lobe is not functioning very well. And many other functions, we call them executive functions. When they're not functioning very well, that's what we term it. But I think sometimes it's used, unfortunately, too often. And I say this because I know guys who are listening, maybe teachers, maybe people who are working in HR and stuff like that. If somebody has a head injury, do not write them off until they've had excellent care, both acute, which we mean in the hospital, rehabilitation, and then you do assessments. Because a lot of people do well, and with support, if I could mention you some names, which I will not, people recover, go back to life, do even better than they did before.
Okay.
I think maybe one that's in the news that people remember is Chris Froome, cycling.
Yes.
He had a moderately severe head injury when he bumped himself, But now the guy's back cycling. So giving people the right support is very important.
So we should not just rule people out.
Don't write people off. And actually, in some cases, like kids, sometimes it takes years for you to see that recovery. That child starts to make up. You take them to school, you give them the right support, you put in the relevant support, the child adapts, the child gets on with life.
Talking about children, now that I'm always very passionate when it comes to children and their brain injuries, do certain brain injuries affect children's development?
Yes. So,
like which ones?
So remember when you said there are different causes?
Yes.
Let's talk about the ones we can prevent.
Yes.
Yeah.
So
the ones you can prevent is what you did when you are pregnant.
Yes.
That includes right diet, alcohol, the ones
then
we talked about.
Do that, so that
or you
happened.
Getting the right prenatal care and the baby is starved of oxygen. Yeah?
Yes.
So babies' brains try their best to adapt. We're born with a survival instinct.
Yes.
So if you put in structures to help that child, many of these children adapt and catch up. Or even if they're behind, they're still on the same trajectory. You can see that the child is continuing to make progress. Then there's the trauma you get. But then let's talk about another important thing, immunization. Meningitis is something that if you take your child for all the relevant immunizations, you reduce the chance that they will get various forms of meningitis, including TB.
Okay.
So every investment that people do for public health, general health, is good for your brain.
Because Kenyans really fear a lot of immunization, especially the free ones. Watoto watafanywa. You've heard stories given of the past history that happened in a certain county where children were injected a wrong polio drug.
Yes.
So many Kenyans are fearful when it comes to free immunization programs.
I understand, but let me tell you something else that's interesting about the brain. We're very bad at understanding risk, because the same person who will not take immunization will play the lottery, and the odds there are worse.
Yeah, true.
So immunization is one of the most important things we've done in modern medicine. Okay. If we think about smallpox, we don't think about it so much. Polio now is made a bit of a resurgence. There's so many things that give children better quality of life, and part of that is engaging with the public health systems and immunizations that we're supposed to have.
Okay, so we should not fear them.
Yes.
You talked about, let's assume there's this particular lady who did not hear your call or has just been drinking away, chewing whatever she needs to chew and smoking whatever she needs or to do. And then a child is born with a complication. What are some of those diseases, those complications that will affect the child, if you could name them by name?
So some of the conditions, there is alcohol fetal syndrome, where the brain fails to develop very well. Children normally present with delayed cognitive function. What I mean by that is hanyiti vitu vizuri.
Slow.
Yuko slow.
Okay.
Yeah.
And these children, they can grow up to be slow in future.
They will. You do pay a price for not getting the right thing. You get a problem with their head start.
Yes.
This person will need other techniques to compensate
and may not reach alcohol what?
Alcohol fetal syndrome. So they may not catch up. They may not catch up. Then there are things to do with infections. So if you get infections in the womb, so for example measles and some of the other diseases, rubella, this can cause blindness or loss of hearing in the baby. Syphilis can affect the brain development. So if you're pregnant and you're having problems down there, please get checked so that you can be treated early, because that's important for the child's
so you getting an STD can affect your child's
STD can affect your child's development
on the brain.
Yes.
On the brain.
Yeah.
Okay, is there another one? You've talked about there are measles, rubella. You've talked about the alcohol fetal.
Yes.
What did alcohol fetal what?
Fetal syndrome.
Okay.
So the other one that we talked about is folate.
Okay.
So the brain is interesting, or the neural whatever. When you're born, or rather when you're first conceived, you're a cell and then you multiply. So you're like a sheet.
Okay.
And then you fold over and you form like a tube. That's why the insides of you are like a tube. And then the interesting thing is that you start to zip up from the middle of your chest, at your back, coming up and down.
Like on your spinal cord.
Yeah, on your spinal cord, coming up to the brain. So if those people who don't have enough folate in their diet, what tends to happen is that they have problems at the bottom. So this is called spina bifida, which can also be associated with extra water in the head.
Yeah, I've heard about
And also
that.
you can have a problem at the back of the head and also the brain development itself. So that's why folate. Ukijua uko pregnant, please eat your vegetables and start taking folic acid.
Can the water be drained out?
Yes. So there are operations that we do, and there are different kinds.
Okay.
So one operation is where we put a tube in the head into the abdomen. That's called ventricular peritoneal shunt. Big name, like ventricle ni kichwa, peritoneal ni tumbo, shunt ni umesongesha maji kutoka kwa kichwa.
I just know the shunt part because I heard about it last week.
Yes.
Okay.
And then the other one is sometimes you can put a hole inside the head, so it's like a bypass system. Vile tuko na expressway.
I hope you
can create an expressway inside the head so that fluid moves from one chamber to the other and bypasses the normal system.
Isn't that dangerous?
I think that I'm
imagining. No, you see, just raise that brain that you raised.
Yes.
I'm imagining you're saying you pierce a hole. That's
Yes.
what you meant. Across it.
Yes.
So that this person can be able to survive and fluid can pass through or whatever needs to pass through in there. In the future, wouldn't that cause a problem?
That is why you need a trained specialist to do it. Yeah. And that's why surgery takes a long time, because not only do you need to know how to do it, you need to know the consequences if things don't go quite so well. Yeah. But if it's done well, it actually saves lives and allows these children to grow normally. There are children that have had this procedure who are, let me put it into context. When I talked about spina bifida, one of the professors who was in charge of one of the departments in neurosurgery in the US and one of the most senior women had spina bifida. So these children, when they're given the right support, they can be anyone. They can even be a neurosurgeon, you see?
Yes.
Yeah.
So we should not give up about the cause.
No.
Now, let's assume we have a child or an adult in ICU and they have a lot of brain injury. What usually happens when someone is in ICU?
When someone is in ICU, the reason why in ICU it's called intensive critical unit or critical care, kuna majina mob. But the reason why you're there is that you need at least more than 2 organs to be supported.
Okay.
So if I look on the more severe end of the head injury, one of the things that happens, say you have a road accident and we term you severe, we put you in the ICU, and what we want to do is, in brain injury there is the primary and then the secondary injury. Primary injury is whatever happened when you had that accident.
Okay.
Secondary injury is what happens because after that injury things are not working well.
Okay.
So like hypoxia, which is lack of oxygen, your blood pressure being too high or too low.
That's the primary?
So no, that's the secondary. So primary ni kama nimekugonga kichwa na rungu.
Then I start bleeding.
Yeah, that bleeding that happens, any trauma that happened at the point of impact, that is a primary injury.
Okay.
What we're trying to do our best is to stop any other injury after that. That's secondary injury that can come from any disturbance of glucose, of oxygen, of blood pressure, of any extra metabolites, of seizures. So a lot of times, if somebody is severe, we will deliberately keep them asleep. We want everything to calm down. Okay. Because remember, if I gonga, you say I slap you.
Yes.
See, your cheek swells.
Yes.
Same happens to the brain. The brain's reaction to trauma is to swell.
Okay.
Yeah. So what you want, but it's inside our head. It's a closed box. If you look at your skull, ngumu. Kuna hata wengine ukigonga unasikia hiyo sauti.
Yes.
Yeah. So when you're at a certain age, when it's starting to swell, we want to calm everything down.
Okay.
And so it's easy. It's often that we keep you asleep. We control everything. We give it a few days. We do repeat scans. We might have a probe in the head to look at the pressures, and your family then gets updated. We're at this stage. We're going to do this. We're at this stage. We're going to do that. People tend to ask me, how long is it going to take? Every patient is unique. Yeah.
So there's no timeline.
There is no timeline. That everyone is unique. There's someone who will have that head injury. You will not even keep them in hospital because it's mild and they're okay. Someone will have severe, and we will be walking the family through a very long journey and telling them, twende tu pole pole, we'll see where we go. Kuna mtu aliuliza, what is a contusion?
Yes.
A contusion is a bruise on the brain.
I want you to hold that thought because I didn't want you to answer because I want to ask a question about it. That's why I went to the ICU part. If you're just joining in, this is SpiceFM. The show is The Adults in the Room. We're talking to Beverly Cheserem. Dr. Beverly Cheserem. She's a neurosurgeon, and today we're talking about Martha's brain injury. You've been asking those questions. I urge you to send in your questions through our social media handles, SpiceFM KE on Instagram, Facebook, and Twitter. Michael Ross, I know you're listening. We're going to get into your question just after we finish. She gets into the ICU, and I'm asking you also to plug in on our socials and our WhatsApp line 01102886162. Of course, feel free to call in on 0719012600. We're talking about brain injuries. Some of you, have you heard that alcohol you're taking, that holy herb, those drugs that you're taking might affect that baby you're carrying? We need to be more careful as the adults.
Sugar and spice and everything nice. Sugar and spice and everything nice. SpiceFM.
Spice up your life.
In the room, and we are talking to Dr. Beverly Cheserem, a neurosurgeon, and the conversation for today is Martha's brain injury. We're going to talk about healing, what causes it. If you have a burning question, or if you have something that you want to ask, or you're feeling uncomfortable and you never wanted to share with people, you can do so on our platforms. And you know our WhatsApp line, you can stay anonymous and I'll get to ask your question. I was talking about Martha's ICU and what happens, and then I want to get to the question that Mr. Michael Ross was asking. What are brain contusions?
So a brain contusion is a bruise on the brain.
Okay.
And so if you looked at it from a slide perspective, there will be little blood vessels that have ruptured, they're broken, and then there'll be swelling and disruption of the tissue. The contusions can cause different problems, depends on where has been affected and how severe that contusion is.
Yes.
So I think the reason why someone is asking me is because of there's a relationship with things like boxing or things like that, where it's coming into, shall we say, in common language, discussing about various forms of brain injury. Can you heal from a contusion? Yes.
The way you hesitated, why?
But the reason I hesitated is, just like with everything, you need to get the right help at the right time.
Okay.
So when you have any injury where there's any loss of consciousness or any significant impact, like you've been involved in a road accident, you've been on a border or anything like that, then you should get medical attention so we can make sure. Remember, we're talking about primary and secondary injury?
Yes.
We want to limit secondary injury so that your brain can start to recover.
Okay.
Yeah? And so there are various treatments, medications you may need be required for observations. And then, as I said, remember, 18 months. During that 18 months, it's not like we're carrying home, you know?
Yeah.
There are different things we are following up, that everything is in the right parameters.
So the
then
18 months, you're still in hospital?
You don't necessarily need to be in hospital for 18 months.
Okay.
But the care of a patient with a head injury doesn't stop on the day of discharge. Okay. There are plans that need to be put into place to help them recover.
You talked about something about different injuries that occur during a brain contusion.
Yeah.
What are those different injuries?
So there's a disruption of the blood cells that you can see. So they can do something called blossoming.
Okay.
And so sometimes when that happens, it's like the volume expands. It's like it has erupted, and occasionally you may require surgery for that. Oh. More often than not, what tends to happen is that the architecture of the brain is affected. And so remember those things I said: your memory, your movement, your vision, your hearing, your coordination, even sometimes your breathing can be affected. And depending on the nature of the problem, the support structure is individualized in terms of what we need to do for you to recover. May I also be honest to the people listening?
Yes.
it is not, although there's a lot we can do to help you, the best prevention is primary prevention, because there are some injuries that you will not recover from.
What kind of injuries?
There are head injuries that, for example, are fatal.
Yes.
I think people are very familiar with this because of, border riders
Yes.
or extreme sports or things like that. And then there are what you call the long-term effect, where somebody has an injury, but say, for example, for you, Duchess,
Yes.
your gift is your gift with people and connecting with people and doing your job.
Yes.
Yeah? If you suffer contusions in a particular part of the brain, you may, even though you might be able to walk around, dress yourself, you may not function as the Duchess anymore.
So those things you're calling executive
and the things that make you.
Okay.
Yeah.
Now, I'm so curious about this, and I'm coming from a layman point of view. You talked about rehabilitation of the brain. What did you mean when you said we do brain rehabilitation?
So the brain rehabilitation depends on what has been affected. But the other thing that I didn't even talk about is the hormones that make you can also be affected.
Let's go to the hormones then.
So the hormones, for example, cortisol, which makes you wake up. So sometimes people with head injury really struggle to wake up, or they can have their sleep cycle completely disrupted because there are certain connections in the brain. So in the day they're awake, so it makes it very hard to take them to physio. At night they can be awake the whole night. The guy is walking from place to place, and the day
very
they're asleep.
active.
So their day-night cycle can be disrupted. You can also have certain fertility hormones that can sometimes be affected.
From your brain?
Yes, because your brain is like the starter. Unajua that gun that goes off, toof, and then people start the race.
Yeah.
There's a lot of functions like that from the brain, where the brain organizes other parts of the body sending signals.
Okay.
Yeah. So those can be disrupted and need to be looked at in various groups of patients, where depending on the pattern of injury. Then you talk about brain rehabilitation. The brain
a moment before we get that.
Nenda haraka haraka
No,
sana.
unajua ni daktari. na mimi ni layman. See, not a
Si
patient.
kila siku niko na Duchess.
Okay.
Najaribu kukeep up.
You talked about hormones. A lot of women have a lot of hormonal imbalance.
Yes.
Could we associate that with what you're talking about, the tooth of the brain, where something has been triggered or it's been affected?
I would say that women's hormone profile is complex
And different.
because sometimes the problem is in the head, and sometimes the problem is with your ovaries and your reproductive organs. So if you've had a head injury, that needs looking at just to establish, was something affected because of that. But you need a more holistic picture. That's why you go to a clinician who will look at you not just as a head or as a leg, but look at you as a whole, but be aware that these things could be disrupted from head injury.
If we're honest with yourself, Doc, many of us, we've had people say, I got headaches. When you were telling us, go to casualty, go to a physician. Many people will be diagnosed, like the lady we had last week was diagnosed with a bacterial infection. For about 4 months, they did not actually know what was wrong with her. Some could say it was a misdiagnosis. But how can someone go at the extra mile if I'm just uncomfortable? I've been having this particular headaches on and off. I've gone to see Dr. Barbara. I've gone to see Dr. Francis. I've seen different doctors. Whatever I'm given is painkillers, antibiotics, this and that. But after some time, that comes back. How should this person now go? What's the next approach? Because sometimes when you go to a doctor, if we are honest, doc, and you start telling me, I think I need an MRI, they start thinking you're crazy. You get? They're like, you want to just treat yourself. So someone who is in such a situation, because I've had many people talked about it. I had a guest who last week said, before they actually realized what was wrong with her, she had gone through about 4 different hospitals.
So let's talk about headaches that you should be worried about.
Yes.
A very severe sudden onset headache, like someone is hitting you on the back of the head, that should get you to casualty.
Front or back? Or just
it doesn't matter which part, because that could sometimes mean you've had a blood vessel rupture.
Okay.
A headache that's associated with a weakness or loss of vision or loss of hearing, that should get you to casualty. Any headache that does not respond to simple painkillers. Okay. So you have a hard day and you have a bit of a headache at the end of the day. You take some water, you sleep, you have some Panadol or paracetamol or whatever, simple painkillers. That goes away. That's within life. But if you have a persistent headache, that should get you to the hospital. Any headache that wakes you up, In other words, it's disrupting your sleep to the point that it makes you wake up in the early morning, could mean that you have increased pressure in your head. You should go to a doctor. Then the next thing is, how do I get care? So the aim of casualty is to deal with things that have happened just now. In other words, it's not the right place to go if you've been having a problem for months or weeks. There you need to consult a doctor who normally works with the brain, and they're
like
roughly
a neurosurgeon.
Yes, so there are roughly two groups of doctors that do that.
Okay.
One is a neurologist. A neurologist is a physician who has specialized in understanding the brain and how it works, and the other group are neurosurgeons. The difference between the two is that a neurosurgeon tends to treat things which include surgical options, whereas a neurologist has other things. And the two of us really are like your right and your left hand. There are differences, but they complement each other.
Okay.
Yeah.
And you can work together. So you can
Yes.
request for a neurologist
Yes.
or a neurosurgeon
Yes.
if you're finding yourself. Now let's go back to now brain rehabilitation.
Yes.
You talked about brain rehabilitation, and I was just curious about, is it a matter of mindset or is it the physical brain rehabilitation?
So the brain rehabilitation, it's like you're jump starting a car or an industry or things like that. So they go in different phases. There's the acute phase. So if you're in critical care, the kind of things we'll be trying to get you to do is, are you awake? Can you feed? Can you sit out? Do you have balance? Then once you get to the ward, are you able to sit out? Are you able to, some people have additional breathing apparatus like a tracheostomy,
Yes.
which is a tube in the neck. Can we take it out?
The one that people talk like they have a voice box?
Yes, when you have a tube in your neck,
Okay.
that's to help you to breathe. And then we're trying to ask, are you able to absorb normal food? Because before, we have to give you special food and things like that. Then as we go towards the home care, we're now trying to familiarize yourself. Do you know who you are, your name? Can you tell us your needs? I'm hungry, I'm tired, I'm in pain. Do you recognize your family? And then can you recognize a sequence of events? This might be something like you're given a tasks to do.
Yes.
Can you brush your teeth? There are very many tasks involved. First, you must know where your teeth are, what's a toothbrush, toothpaste on it, brush your teeth, etc. So there's a graded program. Who does this? So that depends on where you are. If you're in critical care, you find the critical care team, and the surgeon or neurologist taking care of you takes the lead.
Now that is in
Yes.
hospital?
That is in hospital. When you come to the ward, you tend to find whoever is your primary doctor leads with that. Then when you get into the community, there needs to be a transition plan from the hospital into the community. Other people who may be involved in your care, depending on the problem, could be psychologists, speech and language therapists, occupational therapists. Occupational therapists help you adapt, do things for yourself, and also plan the transition to work. Then sometimes you need a counselor. And sometimes you may need, and actually a lot of people benefit from being in a support group. People who are, because there's the physical problems that you're dealing with, there's the cognitive executive planning, but there's the emotional bit,
Yes.
the trauma associated with going through a very difficult experience, which is very real and important to deal with it, because if you don't deal with that, people don't do as well as they should.
Yes. Now, when we talk about brain rehabilitation,
Yes.
is there a place where it becomes, I've heard people talk about they've been electrocuted. Is that part of the brain therapy?
So the electrocuted, that's electroconvulsive therapy.
Yes.
And electroconvulsive therapy is given by another group of yet specialists.
So
These
not
are the
you?
psychiatrists. No, we don't
Okay.
do that. But the psychiatrists, and also I should have said psychiatrists sometimes are involved in head injury patients.
Okay.
And they use that to treat various mood disturbances that are not responding to drugs. And it's very effective. It works like a jump start on your
Which
head.
mood disturbances?
So you would need to invite a specialist in that area, but things
Okay.
like some forms of depression
Okay.
and things like that, get electroconvulsive therapy or ECT.
Yeah, I've heard about
And
ECT.
it
We had
works,
someone on the show on it.
Yes, and it's a very effective therapy for the people who it's appropriate for. It acts like a jumpstart to the brain and helps the electrical signals improve and not be so depressed, etc.
You talked about depression.
Yes.
Could depression lead to brain injury?
It's more likely that depression can be as a result of brain injury.
The ones you're
So in
talking
other
about,
words,
traumas?
so whether it is trauma, infection, whether you've had a brain bleed, any group of patients that have had any damage to the brain for whatever reason are more vulnerable than the average population to get anxiety, depression, post-traumatic stress disorder, PTSD.
Yes.
Because there's a lot of loss of who you are trying to reconcile what has happened to you. And it takes a lot of effort. The other thing that tends to happen is a lot of people get visited when you're in hospital. Everyone and their mother's coming to see you. When you're in the community and trying to make sense of life, that's a time which can be very lonely, very isolating, very disorienting, and you require a lot of appropriate support.
Because people never come. They're like, we saw you in hospital, you're now at home.
Yes. Sometimes even the
Siumepona,
disorienting.
doc.
Siumepona. And especially in head injury, sometimes there's no physical trauma. Someone is looking at you. You see, if you meet me and my hand is missing, everyone has this understanding. Bev has been through a very traumatic experience.
Yes.
But a lot of head injury, there's no scar to show it. And the patient may not be in a position to explain themselves.
Okay.
You know, sometimes they come to the clinic and they say, I just don't feel like myself. And then you do various screening tests. You identify what the problem is and you put in a structure to say, let's do 1, 2, 3. Let me see you at this point. And then we take it on from there.
We have many people who cry or can say they don't feel themselves. The way you've said, I don't feel themselves.
Yeah.
Would you advise anyone who's not feeling themselves or not feeling that they are the person they have been in the past to come and see you?
So it depends the reason. So if it is after trauma, as I said, where the neurologist or neurosurgeon can help you with that. There are mood disturbances that are associated with any brain trauma that we actually call in a psychiatrist because they are the specialists in understanding how to rehabilitate your mood. Oftentimes we get in a psychologist or a counselor, and then sometimes we talk to you about getting you into a group. And that group may be relative to your community, religion, etc., where you live. So people to give you new things, because now whatever it is normal to grieve the life you had or the things that you had and want to reconnect in a new way going forward. And that needs a frank discussion. So if anyone comes to my clinic, I ask about their mood, I ask about their sleep, I ask about their relationship. Because I ask that because going through...
Doctors like asking about relationships.
Because it is a part of... Unajua health is not the absence of disease.
Yes.
Health is manifesting beautifully in all areas of your life.
Okay.
Including relationships.
It could be mental.
It could be mental.
Talking about mental, there's a question a lady has asked, and I want to tie it in because I've heard you talked about matters PTSD that can cause brain damage. Hi, Duchess, please ask Doc. My husband has been serving in GSU for quite a while. Recently, he was returned home because of some head injuries. He seems okay, but I don't think his mind is okay. They diagnosed him with PTSD, but he tends to forget so much. What I asked Daktari what the thoughts are on this.
So there are a few key informations that you said in that particular piece.
Yeah.
This is somebody who served in the forces and who's had some head injury and is now having problems.
Or maybe even trauma.
They've had some trauma, but also they may have witnessed trauma. And now they're also having problems with functioning like memory. In this particular case, and I say this because it's of this particular case, they should go to the medical team that deal with this group because they require a very special service that may not be applicable to everybody else. Because I say that because that person has to contextualize with the kind of work they do and what they've been exposed to and give them the support that is relevant. I'm really glad that this lady is asking because there are many people who are suffering in silence. Other things that she could get done is to see a psychiatrist or mainly a psychiatrist so that they can work out how to help them. A psychiatrist may refer them to a neurologist or a neurosurgeon or get some imaging just to make sure that the architecture of the brain is working okay. Sometimes the reason why you might be forgetting intermittently could be there are some form of seizures. They're called absence seizures, where 1 minute we're talking and then you're in the room and then you're not in the room and things like that. So what I'd recommend for this lady to do is to go and see if they cannot get a medical specialist within the forces to take the patient to a psychiatrist or to a center that has all the services. So I work in Aga Khan and we have all those people that I have mentioned. And what tends to happen is if one of us can't solve the problem, we have a meeting where we all get together and we ask what is the best strategy for this particular patient.
So she should reach out to the initial doctors that dealt with this case, especially because of the field of expertise the husband has been in.
Yes.
If you're just joining in, this is SpiceFM. The show is The Adults in the Room. Today we're talking about matters brain, matters daktari, and we have the honor of having Dr. Beverly Cheserem, a neurosurgeon who is taking us through this journey. And most importantly, we're talking about brain injury, treatment, and rehabilitation. I'd like you to plug into the conversation. If you have a question, I've seen some of the questions. I am going to actually direct them to Daktari. 0719-012-600 is the number to call. You can DM your questions or send them through also on our WhatsApp line if you want to stay anonymous. That is 01102888162. This is Spice FM. The show is The Adults in the Room, and I am the Duchess of Ikolomani.
Spice.
The show is The Adults in the Room. It's exactly 28 minutes past 9 o'clock, and we're talking about matters of the brain injuries, treatment. And today, if you have any question, anything that has been bugging you, been wanting to have a third voice or someone just share or shed some light on it, I'd like you to do so through our WhatsApp line 01102888162 or through our social media handles SpiceFM KE on Instagram, Facebook and Twitter. Feel free to also call in on 0719-012-600. I have a question from the WhatsApp group. This session is so informative. Thank you, Dr. Beverly, and you're welcome, darling. My concern is about my younger sister who had acute psychosis. Could this be due to a brain injury? How can psychosis and schizophrenia, is it right? Schizophrenia be mitigated?
Thank you very much for calling and being very honest about the situation that you're facing. Mental health is a real issue, and 1 in 4 of us will suffer some form of mental health problem. The first thing I'd like to say is that I'm not a psychiatrist. What you have described requires somebody with the expertise.
Okay.
I think some of the common people that you know, Frank Njenga, Lukoya Tole, who's also my dean, those are the kind of individuals that need to be answering your question about how we are going to treat it, and also what causes it. I know that Professor Lukoye in our institution, together with others, are working on are there genetic factors that contribute to this?
Okay.
Because sometimes various illnesses run in families.
Even brain problems could run in a family.
Sometimes. There are a lot of questions we are asking. Science is about asking the question and then going to look for the answer. But the very first place to start for your sister is to see a psychiatrist and then to be followed on by the same psychiatrist so that they can get the right treatment that works for them.
Then we have another question from Facebook. Okay, there's someone who says, thank you for shedding light on PTSD. I really like that. Michelle Kalen says, I once hit my head and from then on I used to feel confused at times. I also felt pain in my head when I tried to run or to bend. What may be the problem?
Michelle, thank you. That what you have described is something called post-concussive syndrome.
Okay.
So remember what I said about your library?
Yes.
You shake the books like this, and then it doesn't work quite as well.
Okay.
So in post-concussive syndrome, people can describe a whole range of symptoms. They can describe trying to do a task and never really getting through. Mm-hmm. They can be emotionally labile. They can swing between fits of rage to just laughing to crying.
They change very fast.
Yes, you feel like your emotional control. I think in a way it reminds me of when I was a teenager, where you don't feel quite in charge of your emotions.
Yes.
They can find that when they're in a room and many people are talking, they're finding it very hard to keep up with the conversations and follow. And they get very tired. They can find that their diet is all over the place, their sleeping patterns. So insomnia can come about, or increased sleep. So people have very different experiences. And this can happen even with a mild head injury. So the first thing to tell you is what you experience is real and it is recognized. For most people, these symptoms improve over a 6 to 8 week period, often requiring rest in the beginning, simple painkillers, and then a process of slowly getting back to things, starting with things you do for yourself, then things you do in the home, then the things that you may do at work.
Okay.
During this period of time, it's important that you don't engage in anything that could put you at risk. And here I'm talking about driving.
Okay.
It might be care roles. If you have a young baby, you might need help.
Okay.
Or if you're in the kitchen or you work with any instruments that are sharp or drills or things like that, to be honest with those around you and say, I am not okay, so that you can get the right support.
Okay, you said 6 to 8 weeks, it's treatable. Now, if I have gone through the 6-8 weeks, maybe I'm not a Michelle and I'm at home, I have had those symptoms. 8 weeks have passed and I'm still feeling that insomnia. I feel like I forget sometimes, dizzy spells. What should I do next?
Then you should see a professional, because then we want to work. First of all, remember when I talked about things, we need to make sure that your bloods are fine, because the other thing I told you about, the brain controls everything, and that includes even the salt levels in your brain. We want to make sure you're not having seizures. We want to make sure that your hormones are okay, and that also if you have any other medical problem, they might have been disrupted during this period. Okay. So that's why it's important to get checked.
Allow me to pick this call.
Okay.
Hello, Steve.
Hey, Barbara.
How are you, sir? What's your question to Daktari?
Oh, so Beverly, I have a question for you. I wanted you to highlight more on migraine, because I think I have a problem. So I always experience aura symptoms, like maybe early in the morning I would wake up very well. Then maybe someone disappoints me. So from there I start having aura symptoms where I lose my vision. Sometimes I experience numbness in my face. So because you said the back of a brain is the one which gives us vision. So does it have anything to do with my brain? But I've never had any injury on my brain. So maybe you can highlight more on that.
Thank you, Steve. Doctor will answer you.
Steve, thank you so much for your question. I think that it is difficult for me to fully understand how to help you on the phone. What I would recommend is to see a neurologist, because the things that you have described need to be matched with an examination and the right investigations, and then we can take it from there. Yeah.
Sasa, Steve?
Does it have anything to do with the brain?
So the symptoms that you're describing is to do with the brain. The question is what is causing them, or what is perpetuating them. And that's why my recommendation first is we take it offline and you get seen by a doctor and examined, and have the right investigations first, so that we are sure that when we say migraine, me and you mean the same thing. Yeah?
Okay.
Leaves the show. We'll make sure she shares her contacts, and just stay tuned. You'll get to know where you can reach her out. Thank you for calling. 0719-012-600 is the number to call. SpiceFM KE on Instagram, Facebook, and Twitter is where we are opining on the question and asking questions. The same lady, let me just finish with her question so that we can go to the next one. The same lady, Michelle, says, is it true that getting head scans can cause brain reorganization? This is something I've even seen when you go into a mall. Their mothers will tell you, mtoto wangu atapita hapa, they can't pass. These scans are going to spoil their brain or reorganize their brains. Is that true? That's what Michelle is asking.
So the most common scans that we do in the hospitals are the CT scans and the MRI. The CT scan uses radiation, but it uses a low dose. And in fact, every year we try to get better and better scans with lower and lower doses. So at the moment, the equivalent of a head scan would be if you took a trip from here to New York. Now, no one would say, I'm not taking my child to New York. However, you will not take your child every day to New York.
Okay.
So it is the cumulative effect of the radiation doses that can be a challenge. And so what tends to happen, I recommend, is that if you have any concerns, to discuss it with your clinician. Many times, if you scan the same person in the same institution, the radiographers themselves, the people in that...
they call it out.
Yes, they call it out. They say, Dr. Ray, we scanned this person yesterday or the day before. And so there are checks and balances within the system to reduce how much radiation. That checks and balance doesn't happen if you go from one institution to another.
Or because they wouldn't know.
Because they wouldn't know. To them, it will always be the first scan you're having.
Okay.
So there is something to think about when you're choosing where to receive your care. An MRI uses a magnet, and the magnets are rearrange, give a certain signal and that we look at. To the best of our knowledge, we don't know of any significant long-term effects. There are scientific studies being undertaken to see what may or may not be the problem with having long-term MRIs. But so far, they are deemed relatively safe because once again, it's not like you have them every day. Yeah. And the ones that are in the supermarket, those ones are very, very low doses. Otherwise,
People
the
should be
government and the
scared.
powers that be should not be, would not
Be having them.
be having them. Just one thing of caution though, if you have any metal in your body or you've had any trauma or any surgery, please let us know before you do an MRI because not everything is safe for the MRI scanners. Some of those things in your body, when they're in that scanner, will act like little magnets and utarushwa around if you have not told us that, by the way, this part of my body or that part of my body was replaced with XYZ.
Okay.
Yeah.
0719-012-600. Dano, I see your call. You can call back. We needed to let the card finish. David Wamuhu says, "Hi Doc, hi Barbara. Hope you had a wonderful day. Can eye illness affect the brain?"
So interestingly, the back of your eye is the beginning of the brain. So technically speaking, some problems at the back of your eye are an extension of what is going on with your brain.
Okay.
Some reasons why people might say they're not seeing is because the pressure in the head is raised. And remember when I said that there are different holes at the base of the brain, one of which is where the eye nerve passes. So that nerve can get squished or inflamed because something is happening in the brain. So many times a brain doctor will look at your eye because it is the first sign or one of the early signs of something else happening within your brain. The other thing is that the drainage of your eye is connected to certain parts of your brain. So eye infections that are not treated very well or anything around the face can spread to the brain. So if you're having a problem, that is why it's important to get the right treatment and to stick to that treatment. Si ati leo umemeza tembe, kesho hatufanyi hivyo, because it can result in another problem.
0719-012-600 is the number to call. SpiceFM KE on Instagram, Facebook and Twitter. What else, can be associated to brain injury? Just before you answer the question, there's someone who's really called. Let me just give you a couple of questions to answer. Hello, Spice.
Hello, Spice. My name is Doris.
Hi, Doris. What's your question to Daktari? Endelea.
Okay, naongea na Kiswahili.
Unaweza ongea na Kiswahili.
Okay, nilikuanga na brain tumors. So later I lost my sight. Later they found out that I had TB. Nikameza madawa nikapona, but now I can't see, but still sometimes, okay, most of the time nakanga nyumbani. So nikipatanga, okay, I went through a lot, okay, to your traumas with me, but nikikanga nyumbani, nakuwa na mood. Sometimes nakuwa angry, but the moment natoka nje, maybe natembea, na feel niko nimerelax. So kuna hiyo kitu na mood, alafu isina set, inaweza rudi kwetu.
Doris, stay on the line. Daktari akujibu.
Doris, asante sana kwa kunipigia simu. Kuna maswali bado ninahitaji kukuuliza juu ya ile matibabu ambayo umepata. Ni muda gani tangu upate hiyo matibabu? Na tena kama umefanya vipimo tofauti ya macho ili tuweze kujibu ile swali ambayo umeuliza juu ya kuweza kuona. Hiyo ningeomba tafadhali tuongee kando ili tuweze kuelewana, kwa sababu kuna mambo mengi tunaweza kuongea juu ya.
Stay on. When we finish the show, just listen in. Daktari atapeana namba zake ama vile mnaweza patana ili muwasiliane.
Okay, sawa.
Asante. 0719-012-600 is the number to call. Let me just take a short break. Then when we come back, you can call in and give. My producer is telling me you cannot take this break. Take this particular call. Okay, fine. Yes, ladies. Yes, ma'am. Hello, Spice.
How are you?
Fine, thank you, sir. What's your name, or you want to stay anonymous?
It's okay. My question is, you are at the beginning of the topic, daktari alikuwa amesema maybe the child might have issues when they are not born yet. Hello?
Yes, we can hear you. What is the child might have issues. What specific question or what specific issue do you want the doctor to address on a child?
Okay, that's one on the mother side. If the mother maybe kama kuna engage in drugs or something like that, So how about from the father side? Can it pass kama kuna issue, if there's an infection or something like that of that sort? Can it inaweza enter to affect the child's brain?
Okay, you want to stay on hold or you can disconnect, Daktari Kujibu?
Maybe I can disconnect.
Okay.
Umeuliza swali nzuri sana juu ya afya ya mwanaume kwa mtoto wake. So at the moment vitu zaidi huwa katika afya ya mama wakati yuko na mimba. Lakini baba akiwa na magonjwa tofauti kama tumeongea juu ya STIs, anaweza kumwambukiza mama naye mama muambukize mtoto. Pia normally couples share their lifestyles.
Yes.
So pia mwanaume yeye mwanaume ni kujikaza, pia yeye atengeneze the right environment for the couple. So si ati mwanaume akuwe na chupa yake alafu ana expect mama atamwangalia tu. So there's a correlation between the two.
Yes.
Yeah.
I like that. And then there's a lady who's talking about, it's called Janet. Janet Wambui says, Doc, can you please talk about dementia on old people?
Wow, Janet, that's a very good topic.
Is it part of brain injury? That's the question.
So, dementias can be precipitated. Yani, you can get dementia faster if you have multiple brain injuries.
Okay.
I think there's been a lot of discussions around boxing,
yes,
or people with various sports injuries, and what that means in their long term. Dementia effectively means age-related deterioration with the brain. Sometimes people get them younger, but it's typically associated with older people, and there are multiple causes.
Yes.
It's a whole topic on its own that we could be here the whole day.
Don't worry.
The first thing that you need, I think here I would need to even have a team of specialists, because the people who mainly manage them here are the neurologists. So, for example, in Aga Khan, we have a dedicated dementia screening service. We need to know why it has happened. We need to know whether there are components of it that are reversible, and we need to know what are the best treatment options. So there are various brain conditions that can accelerate it. Let me give you one very simple example.
Yes.
We talk about hypertension a lot of the time.
Yes, BP.
So a lot of the hypertension ni kama, like, if you think about it, it's pressure in the system.
Yes.
So if you have uncontrolled hypertension for very many years of your life, people tend to talk mainly about the stroke or the heart disease. But remember, if a system has a lot of pressure over time, the system doesn't work so well.
Yes.
So we can see age-related changes by people who do not get the right treatment for their hypertension or their diabetes or many other conditions.
Yes.
The brain pays a price slowly over time, and that has consequences.
If you're just joining in, this is SpiceFM. The show is The Adults in the Room. We are talking to Dr. Beverly Cheserem, our neurosurgeon, and today's conversation is about brain injury, treatments, and all those questions you've always wanted to ask. Some of you are going through a journey, some of it's your relatives, some of it's a question that's been bugging. I'd like you to plug into this conversation through our social media handles, SpiceFM KE on Instagram, Facebook, and Twitter. Our WhatsApp line is 01102886162. Remember, you can also call in on 0719012600. I am the Duchess of Ecolomani. That's Mickey Howard. If you're just joining in, this is SpiceFM. The show is The Adults in the Room. It's 10 minutes to the top of the hour, and today we have a guest, a lovely lady. She's not only sharing gems but knowledge. This is Dr. Beverly Cheserem, a neurosurgeon, and the conversation today is matters brain injury, treatments, and anything in between. If you're a layman like me, I'm very sure you've picked something or one or two questions. You can also plug into the conversation on our stream, that is www.spicefm.co.ke. Send in your questions on our social media handles, and the doc will make sure she answers to her best of her ability. For those who are asking questions and been asked to consult, stay tuned. She'll be giving her context or how you can get to reach her. I had a question that we actually had to put on hold. I don't know if you remember. What else is associated with brain injuries?
So you mean the causes or the effects?
Causes and effects.
So I think we've talked about diet.
Yes,
we've talked about trauma.
Yeah, that's
we've
what I'm
talked
saying,
about
what else?
infection.
Yes.
You can have brain inflammation and different conditions that can inflame the brain. So conditions, for example, multiple sclerosis and very many other infections. We talked about, for example, TB, which I think one of somebody has called in and talked about. You can have abnormalities in the blood vessels.
What do you mean abnormalities?
So imagine, like the way this road is,
Yes.
and there's a predicted width it should be and what it should carry, etc. So there are various forms of abnormalities in the blood vessels. Either the wall is too thin and it ruptures, or you end up with an aneurysm, which is where you have a blister in the blood vessel. It could be that it narrows over time, or it could be that you are born with abnormal architecture and it doesn't work so well for your brain, and it can make you vulnerable to bleeds or a starvation of oxygen. Or it could be a blockage within that vessel, both in the artery or the veins. So there are a lot of different things that can be upset in the brain. The specific diagnosis, of course, needs to be established by someone who is trained and understands what investigations to request and how to take that history.
And the effects?
So the effects, we've talked about just everything that makes you, whether it is seeing, tasting,
like your five senses.
Your five senses, your movement, your coordination, other things that people don't necessarily think about. It can also even affect how you breathe. It may have an effect on your heart or your digestion. So to me, one of the reasons I love the brain is that there's no part of the body it does not touch. Yeah.
It's all connected.
It is all connected.
What are your thoughts about society when it comes to brain injury and the stigma or challenges those who have it face?
So the first thing is, when we talk about problems with the brain, I think for a long time, people have tended to have a very fatal outlook towards it. Or people are very afraid of coming to get help. We have an increasing population of neurosurgeons. We're 37 and we have about... In the country, and we have about 20 neurologists and growing. We're centers of training and we're very fortunate as a country to be able to do that. So people don't need to be afraid or feel stigmatized about getting help and should come to various hospitals that can offer that care. I talk about Aga Khan because I know and work there. The second thing that tends to happen is people don't realize just how long it takes to get better. As I said before, your recovery doesn't stop at the point of discharge. And a lot of people need support for 18 months, sometimes longer. Then the other thing to also know about rehabilitation is about adaptation. So you may not, for example, be able to hear very well with one ear, but you might have a hearing aid that helps that. Or you may have various computing or various walking aids, etc. There's so much more we can do to give someone a good quality of life if they seek help and continue to get help in a sustained fashion.
We're in a society where, as adults, maybe as parents, you have a child who had an injury and we give up too easily. And I like the part that you said, we don't give the support that is needed to that mother, to that sister, or to that husband or wife or anyone who has a family member or friend going through this. What support do you feel they need to give that we have not been giving?
There are many challenges that these families face. I think in the acute phase, there's always the financial questions, even in the long-term phase.
Because even brain surgeries or
etc.
Yes. Cheap.
So I think that if you're, from insurance or you work with people who work on funding healthcare, we need to talk about how we're going to fund healthcare around the brain and problems that come up with the brain, so that they are sustained. And that help should be not just in the acute phase, but should also cover the rehabilitation phase to help someone integrate. The second thing is the psychological support. Often when people go through this, a very traumatizing thing, and sometimes families can feel stigmatized or isolated. So we need to keep in touch with the patients who've undergone any kind of head injury and continue to support them in any way we can. Sometimes it is company, sometimes it is support, sometimes it's being understanding. For example, when I talked about the post-concussive syndrome, you're looking at somebody, they look okay. That person might need a very understanding HR department that say, maybe you need reduced hours. Can you work from home? Can we give you some time off? We know you're going to come back, but we need to give you the right kind of support to get there.
Okay, you talked about psychological care, that the social psychological support.
Yes.
It's something that many Kenyans are not up to. Do you believe, in your own experience, that the psychological care, the therapy, the counselings are a good step to healing the brain?
I could say anecdotally, the patients that receive good psychological support, you can see as a loving, caring family do better in the long run.
Okay.
At 1 year, you can see the difference. You can also see families that are better supported cope with the crisis better than those that are left to their own devices. May I also say that the same is extended to the doctors and the nurses and the other therapists that take care of them.
Yes.
There's an increasing acknowledgement that even the health professionals need psychological support
Yes, I've
when
heard
they're
about that.
dealing with, it's called the second hit,
Yes.
where the second victim in the problem. So more and more we're talking about that conversation about getting help. Duchess, please allow me also to go back.
No problem.
The one thing I didn't talk about the brain injury is prevention.
Yes.
And here I'm going to give a message about prevention. In particular, we talked about alcohol.
Yes.
Can I please talk about helmets? Helmets,
Yes.
helmets.
When we're on
Please
these borders.
wear them. The right size, wear them properly. And if it falls once, that's it. Just because it only has a scratch, the absorption mechanism inside that helmet is gone.
So if
If you are a regular border rider, just buy yourself your own helmet. The one that fits on your head.
don't share, don't exchange.
It is your head. You have one. Please, let us wear them. So it makes a
immediately
huge
it cracks,
difference.
You need to get another
The
one.
not even cracks. If we had a helmet here on the table
Yes.
and it slipped and it fell,
Uh-huh.
that moment of impact, that mechanism inside the helmet is gone.
The shield.
It only works the once.
Oh, but many of us don't even know that.
Many people don't realize that, and so that you're sharing helmets, you don't know whose it is, you're not checking on the fit. It should, you're not putting the strap on.
Yes.
Some guys, it's suspended on their head. It does nothing for you.
If someone wants to contact you, if someone needs to reach you, how can they get hold of you?
So I work at the Aga Khan University Hospital, which is in Parklands in Nairobi. The easiest way to get hold of us is to reach out through our call center, which you can get on any social media. If you're an international patient, you can just email at patient.referral@aku.edu. And what I should
Just
say,
repeat the email again.
patient.referral@aku.edu.
Okay.
And you will get a response to that email. So if you go to any of our social media, whatever, you DM or etc., those emails do get to us.
If you get to Google,
If you get to Google, you will find us. And the other thing I should tell you is I don't work alone. So as a hospital, we provide 24-hour care so that you don't have to worry, am I looking for Bev? No, you're looking for a neurosurgeon or a neurologist, you will get one.
Thank you for plugging in to everyone who's listening in. Thank you, Dr. Beverly Cheserem, this beautiful woman. First and foremost, is a lady who still told me to tell you, tell Daktari she has a very beautiful voice. I couldn't agree more with you. Yes, you do have a very beautiful
I'm
voice.
blushing.
Yes, you know how to explain those things. I'm like, oh, I was feeling like I'm in a class. So thank you so much for making time to just enlighten us. And yes, I will be calling you again for more questions. To everyone who's plugged in, asante sana. To those who had questions, you've had the email address and you've had the contact address where you can reach her. Google, Facebook, Instagram, the Aga Khan page. On behalf of my technical team, my producer, Miriam Angel, and I, the Duchess of Ikolomani, it's good night and God bless you.
Spice.